Hi, my name is Dr. Pecoraro. I'm a chiropractor in Westfield, New Jersey. Today I wanted to speak to you about toilet tips for people who have bad backs. First thing I want to tell you, if you have a lot of back pain, going to the bathroom is going to be difficult because when you strain to get the bulky things out, it increases the inter-abdominal pressure, the pressure inside your abdomen. And that increased pressure can very often accentuate any back pain that you're already having. Doesn't always happen, but it happens quite frequently. Now, the best thing to do that I found, if your back is already bothering you or if you feel it coming on, try not to eat too much, because this will cut down on the amount of times and the length of your bowel movements. And as I said just a moment ago, you may find them very much more painful than without the bowel movement. So try to cut down on your food. On the things that you do eat, try to keep them things that are going to not make you have to strain. So that would mean things with a lot of roughage in. And things that have a lot of roughage, the most roughage, are plain fruits and plain vegetables, especially if they're fresh. That's the best. And if they're whole. So try to cut down on your foods that you do eat. Try to keep mainly roughage, so that fruits and vegetables, if possible. And also, you may have what's called paralytic ileus. This is when your colon becomes paralyzed a little bit, or due to the irritated nerves that go to it from the lower back. And if this happens, you may have a very difficult time even moving your bowels. So another little tip that may help with this, if you feel like you do need to go but you're having a rough time, is to rub the lower part of your back, the small of your back, where your back goes in, just above your buttocks. Rub it on both sides of your spine, in the center and about 1 inch to either side. You rub it over there, and you could also go down as far as maybe 4 or 5 inches from the bottom that's touching the seat. And you could rub all that area. Give it a couple of minutes. It might take a few minutes. Try not to rub this before you sit down, because if you have a lot of back pain, it may take you a while to sit down. So do this while you're already sitting down, because if it works well, you may find yourself having to go to the bathroom sooner than you would have been able to sit down. So you're rubbing the back in the lower part of the back, the small of the back, the part where it's just above the buttocks, all the way down the center, down to maybe 4 or 5 inches from the seat. And you can do this down in the center, and to maybe 1 inch on either side of the center on each side. Just put your hand back there and rub it, massage it, and this may help. The next thing that I wanted to tell you was that the jolt from sitting down may bother you. So you may want to lean on something if you can, like the sink if it's next to it, or the wall or whatever, something if you can. And when you're getting up, you may want to also lean on the sink, or use your hand that's away from the sink in between your legs on the seat, pushing down to also help. So these are things that they may sound a little gross, but if your back's bothering you, you're going to be glad you listened to them. So I hope this has been helpful to you, and I'll try to bring you more information at a later date. Thank you.